Well, we can define the quality of the oocyte as the possibility to achieve a good pregnancy and a healthy baby. So the ability of the oocyte to fertilize, to develop a good embryo, and this embryo to implant and give a normal pregnancy. No, it's not exactly the same. In most of cases, quality and quantity goes in a parallel way. So normally they're related to the age of the woman. All women, they start from the adolescence to the menopause with a certain number of oocytes, and they are losing them during the years. And the quality of the oocytes too also is going worse during the years. But there's some cases like early menopause, for example, when we have young women with good quality oocytes, but with a very low quantity. So they have few oocytes, but of a good quality. And on the other side, for example, polycystic women, they can have 40, 41 years. So normally we expect low quantity, and for their condition, they have a lot of oocyte, but these oocytes are of bad quality. So in these cases, they are not the same. So we need a lot more oocyte to have a good pregnancy. It's not easy to evaluate the quality. I could say the best form to evaluate the quality of the oocyte is to see how they fertilize and how the embryo will develop, how the embryo will grow, and obviously the result of the transfer and the pregnancy. So it depends not only on the oocyte, but also on the sperm and on the ability of the biologist and the technique that is used in the laboratory. But most of all, it depends on the quality of the oocyte. Causes could be different, and a lot of them. I think the principal cause is the time. Oocytes are cells that they don't rejuvenate, they don't regenerate. So we start our life with these cells, and they follow through the years to the menopause. So they're exposed to pollution, to oxidative stress, to radiations, to a lot of damage that can lower the quality. Obviously, there's some pathologies like endometriosis or like some cancers, so chemotherapy or radiation that could lower more and more and more this quality. It's very hard to ameliorate it. I think the best option is to prevent the loss of quality. So having a normal life, normal habit, good diet, for example, to avoid any kind of contamination, pollution, what we can, obviously. And then now we can use some vitamins and antioxidant products that will restore just a little the quality of the oocyte, so they can lower the effect of the oxidative stress.